I'm Dr. Karen DeSalvo, and I'm the immediate past president of the Society of General Internal Medicine, and I'm right now serving as the Chief Health Officer at Google Health. Across the journey of my career, I learned definitely from my patients that there were a number of social and personal factors that were driving not only their ability to engage in the care plan, to stay well or to get well, but frankly just affecting their life outside of the tools I had in my toolbox as a doctor to help them. I think all this really came to a head for me at the time of Hurricane Katrina in New Orleans, when in a very short period of time, the social determinants of health were dramatically impacted for our entire region because the storm wiped out schools and libraries and faith-based institutions and jobs and impacted the environment. I mean, you could go on and on. I think for me as a doctor, really drove me to want to do more to support the context in which people's health was happening, in addition to being able to address their health.
Social determinants are important in general medicine and in healthcare because as a physician, I am quite humbled by the task that I have of prolonging healthy lives when I can and relieving suffering when I cannot. And I know I have maybe 20 or 30 minutes with a patient 2, 3, 4 times a year to do that task. And the truth is that the majority of what explains people's health outcomes is not what I do. It's their genes that they're born with. It's the family and the environment that they grow up in, where they live, work, and play, and their health behaviors. And physicians need to broaden their scope. They need to look up from the patient that they're sitting from, look up from the screen, and embrace the fuller set of determinants in people's lives that shape their health outcomes.
The social determinants of health are the conditions in which people live and learn and work and play that have a material impact on the health of individuals, but also of populations. This is big, as it sounds. It's a mix of things like economic opportunity, educational experiences and opportunities for quality education, plus things like environmental exposures, public safety and air quality. And then, of course, a mix of things that are much more personally related, like exposure to things like racism or access to quality housing or a safe place to lay your head at night. This has been known in the public health community for generations that these big, broad factors are a huge driver of health outcomes. As much as 80% of people's health outcomes are related to these social determinants of health, and only about 20% to medical conditions.